Stress in the workplace and people who develop anxiety and depressive disorders because of that is poorly recognised, in part because they don't complain, and in part because employers fear that the cost of getting people off the workforce to get treatment will be considerable. We think that people should be treated over the web, because then they can do it privately in their own time, and the results of web-based interventions are increasingly looking to be comparable to face-to-face treatments. It's an exciting development.
I actually found the presentations quite energising and quite inspiring, actually. A couple of key speakers talked about intervention strategies to reduce the risk of psychological harm, especially for industries where staff might be exposed to quite a lot of traumatic material, whether that's either abuse or visual material or counselling or support. It was actually really quite good. The fact that organisations are thinking more broadly, more than just having an EAP to tick the box. It's more about a whole range of interventions that can be used for early intervention. I think that was really quite good. I think people have gone away with some really good ideas. As chair, I noticed a lot of people actually taking down a lot of information and writing furiously, so that's always a good sign.
Conference is going well. We've had a number of presentations in areas like improving return to work outcomes with chronic pain. We've had discussions around mental health awareness programs in the workplace, and I think we're seeing that there's a lot of progress in these areas. One of the areas that I think is coming into focus more is that we're starting to also recognise that there's a lot of variation in what our clinical service providers do out there, and I think that's one of the big emerging areas. So some of our workers' compensation authorities are looking at a range of quality assurance initiatives, because we are starting to recognise that we're getting a lot of variation in what those physical therapists, psychologists and GPs do out there.
I'm going to take you through a few stretches.
I found it very informative. Yeah, it's been good to get perspectives from other people from other states.
Yes, I find it very professional, and it basically fulfilled my expectations so far of the information. It gave me an opportunity to ask a question and reinforce some of their ideas, yes.
I've found it to be extremely good. The speaker's very engaging, covering a wide range of topics, which has been wonderful. And for me personally, I came here with one sort of set agenda to look at things, but that's been broadened dramatically through the speakers and listening to people talk. It's been fantastic.